Hi, this is Batia Wiesenfeld. I am the director of the Business and Society program. I'm also a management professor here at Stern, and I'd like to welcome all of you who came to join us for the second in our series of faculty insights on COVID-19, which are going to now be twice a week on Tuesdays and Fridays from 12 to 1. And in fact, I have here Anindya Ghose, who is going to be talking to us about unlocking technology and data science to combat health pandemics. Anindya is from our marketing department and an expert in the economics of technology and digital marketing, and in our TOPS department and our marketing department. I just want to let folks know that there are a number of initiatives under this broad umbrella. In addition to today's talk, we have next Tuesday, Rob Engel is going to be talking, and that will be moderated by Viral Acharya. And in addition, you should, by the end of the day, be receiving an email about a new website that we are setting up that has a number of faculty thought pieces on COVID-19 and responses to it and what it means for the financial system and the economy and policy. All of those are going to be available. And in fact, two of those pieces are written by our guest today, Anindya Ghose. So without further ado, I'm going to turn it over to Anindya, who's going to lead us in sort of a big picture, and then we'll move into a brief fireside chat where I will ask a few questions, and then I'll open it up to questions from the audience. If during the talk or at any point, any of you participants want to ask a question, please use the Q&A box that you'll see on the bottom of your screen. If I'm hoping that one person can just let me know that they can hear me by typing in a yes in the chat box, just so that I have, looks like it's all working. So then let me turn it over to Anindya. Thank you so much, Anindya, for joining us today.
Thank you, Batia, for having me. It's nice to be able to do this webinar. So I thought I'll kick it off by talking about some examples of how technology has been used for predictive analytics in this pandemic. As we all have maybe seen, a number of countries have tried to mitigate the spread of the virus by unlocking the potential of digital platforms, telecom providers, machine learning, and big data. And this is notable because at a time when platforms and especially the tech industry are under populist attack, COVID-19, I believe, could serve as a reminder of the benefits of digital platforms and their associated technological ecosystems. So let me start by an interesting story. Around midnight of December 30th, on 2019, a Canadian AI startup platform called Blue Dot picked up some, a cluster of unusual pneumonia-like symptoms happening around a market in Wuhan in China. But it turns out that Blue Dot had spotted what would eventually become known as COVID-19, but 9 days before the World Health Organization actually released its statement alerting people to the emergence of this novel coronavirus. So how does Blue Dot work? So Blue Dot essentially uses natural language parsing and big data and machine learning, using data from thousands of sources, including statements from public health officials, social media, global airline ticketing data, livestock health reports, and population demographics. So it turns out that Blue Dot was also able to correctly identify and predict the various cities that were highly connected to Wuhan, using things like global airline ticketing data. And this helped them anticipate, where the infected users from Wuhan might be traveling internationally. Okay? It turns out at the end, 11 of the cities that they had predicted would have the highest incidence of, COVID contagion were accurately predicted. These were, based on the global airline ticketing data that I just mentioned. Okay. We also have seen, other examples of, the use of predictive analytics. Google's DeepMind, for example, use deep learning to analyze the structure of proteins associated with COVID. The basic idea is, proteins can do a lot of the work of organisms, and understanding the three-dimensional shape of proteins in COVID-19 could conceivably provide a kind of blueprint of the virus behind the disease, which could conceivably then be helpful in coming up with a vaccine. Okay, so Google's DeepMind unit, in fact, offered up data files for its, best guesses of the structure of these proteins that might be implicated in this coronavirus. And keep in mind that, Google's DeepMind's deep learning would not have been possible without 6 decades of pretty exquisite science and data curation around the world. Another example is Baidu, a very well-known Chinese tech company, the equivalent of the US Google. They use cameras with computer vision and infrared capabilities, infrared sensors, in fact, to predict people's fevers in public areas. So if you're running a fever or temperature, they could screen up to 200 people per minute and detect their fever within a range of 0.5 degrees, which is remarkably accurate if you think about it. And they've been using that in railway stations as an example. Okay. So next, let me talk about, highlight some examples of how technology has been used by institutions to empower consumers. Okay, so I'm sure many of us have heard of Alibaba and Tencent. They essentially pioneered these color-based QR coding systems for tracking individuals who have been affected with the coronavirus nationwide. What they basically did is they asked consumers to fill up a form online, and based on that, users received a color-based QR code, essentially, which is a barcode, on their mobile phones, indicating their health status. And then if you get a red code, that basically means you're quarantined for 14 days. If you get a yellow code, you're quarantined for 7 days. If you get a green code, you're free to travel. This is a very powerful tool that was deployed at various checkpoints in China, travel checkpoints like airports and train stations and customs and immigration checkpoints as well. It's also being used at the neighborhood level. In Hangzhou, for example, where Alibaba is based out of, various apartment complexes have asked their residents to visit, show their QR codes as they enter or exit the building. So if you have a red code, you absolutely cannot exit the building until it's 14 days past. Another example is our apps, such as the close contact detector, which lets people know if you are at the risk of catching COVID based on if you've been in close proximity with any confirmed cases of COVID. Okay, whether it's a suspected case or a mild case, doesn't matter. You will get information about co-workers, people who share a classroom, people who are living together, people who are working in the same building, passengers in the same airline. For example, on a flight, passengers within the same row, within a 3-row radius of the sick patient, would be informed that you have a passenger, in close proximity to where you are. Another example of an app that empowers consumers is what was invented very recently in Taiwan. This is called the face mask app. A very, sort of an tech entrepreneur, he worked with the government of Taiwan to provide real-time location-specific data to the public on which stores actually have the face mask, the N95s and so on, because they didn't want the kind of panic buying that happened during SARS in 2003. So inventory from stores can be tracked down at the individual, zip code level. They have information on the stockpile of masks, et cetera, which lets people, know right away which store they should get to in close proximity. Another example of empowerment is this Trace Together app in Singapore that informs users about, other infected carriers, very much like the close contact detector in China. So now you've seen all these examples of robots performing some, very critical contactless work, such as the delivery of food and medicine in hospitals in lieu of nurses. Many hospitals that are, full of COVID patients, there is some non-trivial risk to the staff, right, the healthcare workers, So instead of just human beings, we are seeing robots perform some of these important tasks of delivering food, medicine, hand sanitizers, et cetera, et cetera. So these are all examples, of how digitally empowered citizens can access accurate information and relieve the pressure on public health authorities in times of these emergencies. Right? So now let me next talk about some the two broad data science modeling approaches that have been undertaken so far, based on, again, prior expertise in health pandemics and also what we're seeing today. Okay? So some of you have probably heard about in the past during the H1N1 crisis or even the MERS crisis, scientists have used aggregate measures like Google flu trends or Twitter data. But it turns out that they actually missed the early waves of the 2009 H1N1 pandemic influenza. And they, in fact, overestimated activity during these outbreaks. The same goes for Twitter. It could provide, very high-level surveillance data, but it had very variable success. If you go back and look at some of the academic papers that have been produced by the epidemiologists, turns out that the main challenge with these methods is in distinguishing between activity related to an individual's own illness and those related to media awareness or heightened media awareness and interest about influenza or flu during the flu season. Okay. So given this drawback, scientists and academics realize that there's a greater need for enhancing traditional surveillance with new objective data from real-time sources. So during this health crisis, epidemiologists have been tracking and data crunching, and it turns out they've primarily sort of advocated two broad data science methods in play here. The first is an aggregate level analysis known as shelter in place or social distance analysis, which is the basic idea is, what fraction of people who've been told to shelter in place or socially distance themselves are actually complying with those laws. Okay. So mobile carriers in the European Union, in Austria, in Italy, in Spain, they have been sharing data with health authorities to help monitor if people are complying with social distancing. Okay? So this is very aggregate level analysis. It's not individual level analysis. In fact, if you one of the things we learned from the Italian, state of affairs is that as sort of COVID, continued to rattle the world, one puzzle sort of emerged for health officials, the extremely high infection and mortality rates in Italy and Spain compared to the rest of the world. Okay? Several theories were floated. Was it due to the disproportionately high percentage of senior citizens in Italy? But then Japan also has a very high aging population, and they haven't seen this kind of impact. Was it because of the high percentage of smokers in Italy and their lung capacity? But then again, Greece and Russia also actually rank higher than Italy in smoking rates. And yet the extent of penetration in COVID in these countries were not as high, nearly as high as Italy. Okay? So it turns out that Vodafone, one of the main telecom providers in Italy, recently provided Italian officials with anonymized customer data to track and analyze population level movements in Italy. A crucial insight that arose from the analysis of telecom data was that up to 40% of residents in Milan and in the Lombardy region were still moving beyond a 300 to 500 meter range from their homes, despite the shutdown, the lockdown, regulation. So basically, there was at least 40% of non-compliance of social distancing and self-isolation, which is likely to be a significant factor in the extent of diffusion of COVID in Italy. Okay? So now this is in contrast with what we know as contact tracing. Active contact tracing is very individual user level analysis. Okay, and what happens over here is we've seen a different set of countries take a very different approach. We've seen successful use cases of active contact tracing in Taiwan and China and Singapore, Russia, Israel, South Korea. This requires a combination of merging geolocation data from smartphones with CCTV surveillance footage and GPS data from cars, offline credit card transactions, ATM banking records, et cetera, et cetera. Okay? So basically, there's this remarkable difference in essentially the level of analysis of the data required, which raises an interesting trade-off between public good and privacy that I'll talk about shortly. Okay, so what kind of data do we need for contact tracing and pandemic surveillance, right? So turns out that during SARS in 2009 and MERS in 2012, the accuracy of location data and the sophistication of technologies for tracking were very much in its infancy. Okay? Now, today's pandemic response can be quite different because of the advances in digital technologies. Okay? So what kind of data are actually needed for this kind of contact tracing? Very highly atomic, granular data about consumers' current location and past trajectory, which can be taken from their smartphones. Okay, so the past trajectory data reveals all of the locations that a given consumer has been to the immediate past, and you can define the window accordingly. It turns out that today's smartphones are sophisticated enough to be able to disclose a user's location within 1 feet with up to 91% accuracy, okay, which is remarkably different from even a few years back. Now, we also know from health experts that COVID transmission occurs between people who are within 1 meter of each other for 15 minutes or more. So now if you think about the fact that one can pinpoint users' location within a feet with 91% accuracy, contact tracing becomes really, really effective. Okay? So I've been, some of you are probably aware of some of the work that we have done. I've been working with telecom providers and digital platforms and wearable tech companies, app developers, advertisers. Some of the work was captured in my book, Tap. In one of the focus areas for work was using machine learning techniques on very atomic and granular consumer trajectory data. Now, this was obviously for a very different set of purposes for targeted marketing or targeted advertising. But turns out that the same models and methods that we had used in the commercial world can now be replicated in the health pandemic. An example of a paper, one of my co-authors is Professor Batia Wiesenfeld. She and I have been working on a number of these papers to essentially take these very granular location, geolocation trajectory data and better understand consumer behavior. I've also done some work with wearable tech companies and devices. And there's some interesting insights from that we win, and I'll talk about that later as well. But suffices to say at this point that wearable devices are a very powerful instrument for contact tracing and identification of infection rates. There was an interesting recent work done by Eric Topol, who's a very well-known epidemiologist, who and his co-authors identified that elevated heart rates that you can get access to from wearable devices can be used to predict the probability of COVID transmission and COVID infections. Okay? So again, all of these are indicative of the various possibilities for contact tracing that again many companies and countries have successfully been able to do. Let me talk a little bit about what's going on in the US, right? So this graph, these images showed up yesterday in the New York Times. And it's sort of, like they say, a picture tells 1,000 words, right? So these images are very informative about did Americans stay at home even as the virus spread, right? So as we all know, stay-at-home orders in the US have now nearly halted travel for most Americans, right? But it turns out that people in Florida and the Southeast and other places that waited to, get these orders, or in fact enact these orders, the governors waited to enact these orders, those citizens have continued to travel widely, right? And what that happens is it potentially exposes
many more people to the coronavirus as the outbreak accelerates, according to the analysis of cell phone location data. So this is both the images. The one on the left is showing you, based on cell phone location, where people were traveling last week. And you can see the divide in travel patterns, right? Vast swaths of folks in the West and the Northeast and the Midwest, they have complied with the orders from the state and local authorities. And it tells us that these reductions, even less than a mile a day, can make a big difference. But not everybody behaved.
half a dozen of the most popular counties in Florida, like Jacksonville and Tampa, you can see that in the map. These folks did continue to travel much more than folks in other parts of the country, and this definitely, increases the likelihood of putting other people at risk. So next, I'll show you specifically an image of the spring break beach folks on Florida beaches, right? So you can see, I know the background is a little dark, but you can see a bunch of orange dots on the screen. This is basically a beach in Fort Lauderdale, in Florida, and this is basically all these beachgoers on spring break who, for various reasons, they decided not to stay at home, and they were on the beach. And then the next image tells you how they disperse after the spring break, how these beachgoers from beaches in Florida disperse, for the rest of the country. Multiple states saw the entry of these, beachgoers. So now this is also available from cell phone data, and it sort of enables us, people interested in looking at this from a data science perspective, multiple opportunities. We can do quicker assessment of the probability of exposure in a given area or a cluster by cross-matching of the location, smartphone location data. We can get far more accurate and detailed time-based historical information of the infected individuals and their close circles. And this is important for stopping the chains of transmission, right? If you want to establish the chain of transmission and stop it, that cluster information is very important. One can complement CCTV records to identify people in particular infection hotspots and then how they disperse throughout the country. You can also use a database of medical prescriptions and purchases of medicines to trace individuals who are in risk of avoiding quarantine. And again, that's important because we know that not everybody is complying by the social distancing regulations. There's a lot of analytics and data science based approaches you can take to sort of understand better what's really going on. Okay. Now, one other thing I do want to talk about is this issue of undetected cases. So one of the big problems with COVID, why it's sort of wreaking havoc around the world, is that a lot of the carriers have not been detected. Right. This can happen because of at least three reasons. The first is, a lot of people are asymptomatic at least to 14 days. Okay. Second reason is you may have limited testing capabilities, which we have seen in many parts of the world, including the US. And the third is because of restricted testing criteria. Okay. As it turns out, what we have learned from examples around the world is that, asymptomatic users constitute about 52% to 86% of all cases. You've seen examples from Diamond Princess cruise and from the small town of Italy in Bohemia. We've seen that from Hubei, where 86% of the infections were undocumented in Hubei. Right? And so what that means is, if up to 52 or 86% of cases are undetected for any one of these three reasons, that's a big problem, right? So the rise of the rates of this undetection and asymptomatic cases, which varies from 50 to 86%, suggest that we need at least a few other ways to tackle this. First of all, we obviously need to expand our surveillance efforts. Along with social distancing and self-isolation, we have to start doing, randomized testing in large scale. Okay? We can't probably do mass testing, but we can certainly do randomized testing. Okay? We should be, in fact, doing what we know as stratified randomized sampling to help us learn where the virus is quickly. What stratified random sampling does, it enables us to accommodate differences in infection rates across states and cities by giving greater weight to those states with larger population and higher uncertainty of infections. Okay? And if this stratified random sampling is done over time, it provides a clearer picture to when the infection is likely to happen and mortality rates. In fact, there's some examples. India has been implementing some small random sampling of people who displayed these symptoms but didn't have any travel history. There are reports that California has done some random testing as well, and this surveillance has informed their policy. They decided to shut down, several days before New York did. And Germany has done this in some way. So that's sort of one method, randomized stratified sampling. The second one, and this is where genomic science comes into play, and there's a very well-known scientist by the name Trevor Bradford who's been doing some phenomenal work looking at how you can detect undetected cases by analysis of viral genomic data, because as the virus mutates over time, it looks different. Based on that, you can predict who's likely to be affected and what part of the world. And the third method that is being now used is using AI to enable nanosensors to diagnose coronavirus in a breath test, even when there are no symptoms. In fact, the professor by the name of Hosem Heck and his team who are applying this nanocenter technology to facilitate rapid remote screening. These basically nanosensors are these nanoscale devices that measure physical quantities and convert those quantities into signals that can be detected and analyzed. Okay, so at least we have some hope in tackling the undetected cases using these three, and we should rapidly adopt this on a large scale. Okay, so the last topic I want to talk about is really what does this all mean for the obvious trade-off between public good and civil liberties, right? So as I'm sure, some of you might be thinking at this point that access to such atomic data is an infringement of our liberties. I agree that there is a very clear line between population level analysis of social distancing that a few countries were doing and individuals tracking through contact tracing that a few other countries are doing, and they might raise some greater privacy concerns. So far, what I've seen, at least in the US, is unlike some of the other foreign governments, US authorities seem to be focused on potentially harvesting location data using a de-identified aggregated form in order to track the spread of the virus. In fact, Google and Facebook have been enormously helpful in coming to releasing this data and sharing this with the US government. We know that the CDC and other local governments are already using anonymized data harvested by mobile advertising industry. So, privacy lawyers will tell you that it is legal, it might be legal for federal and state and local authorities to use anonymized cell phone data. For example, to predict whether people are flouting the shelter-in-place orders or not. The concern that they would, espouse is that, companies or institutions might enter murky legal ground if they attempt to track locations of individuals on an individual user basis, based on contact tracing. Okay? But to me, though, I have a slightly different opinion on this. I believe that these are challenging times. The challenging times call for more innovative measures with respect to regulatory thinking. The flip side of all of this is the question if individual level contact tracing and other individual level analysis using location data can lead to better outcomes for pandemic prevention, then shouldn't we recalibrate what is an acceptable level of privacy, right? These are challenging times. We cannot expect the same level of personal privacy during public health emergencies involving infectious diseases. Okay? So what needs to be done to make this happen? Well, first of all, I'm basically advocating, effective and expedient coordination between public and the private sector. Okay? We need to facilitate that information sharing. How do we get that? To enable that, we basically need to give assurances to telecom providers and tech companies and mobile advertisers that such data sharing will be exempt from any adverse regulatory action or private lawsuits, even now or later. Okay, we need mandatory data sharing exemptions. These are desperately needed, and I think working together and creating these narrow exceptions, we can make this happen. In fact, we are seeing this with competition laws now being changed by the FTC and the DOJ, and I think we can make this happen even for data sharing between the public and private sector. Now the problem is that there's been, as I said at the beginning, there has been a lot of backlash against tech companies and telecom providers as well for allegedly mishandling data and collection practices. Okay, so some of you might recall, just a few months back in 2019, there was a massive class action lawsuit against the 4 biggest American telecom providers for allegedly selling location data to third-party brokers. Okay, so AT&T, Verizon, Sprint, everybody was under the gun, and the FCC proposed a $200 million fine, okay, for the 4 top mobile carriers. So something like that puts you on the back, on the back foot, right? So these companies have the data, they're willing to share it, but they need the exemptions, okay? Because if you think about the Fourth Amendment in the US or the federal statutes like Electronic Communications Privacy Act and the state law like Utah's Electronic Device Location Amendment Act and so on, these acts are very limiting. They sort of constrain what companies can actually do, what sort of data they can hand over. But obviously the federal and the state authorities have the power to overturn these things. Look, I mean, tech platforms are going out of the way to help us. Look at Facebook and Google. They have made a lot of invaluable data available to the government in the crisis and to academics and researchers too. They're providing disease prevention maps in 30 countries. They're looking at aggregate location map data and releasing that. They're looking at people movement, social network connectivity, releasing that to the government. They've even added a movement range of map layer, looking at differences before and after the pandemic. They're looking at population density in half-kilometer tiles in many regions of the world and sharing that. Google raised a fascinating data set today, the COVID mobility data set that tells us whether people are actually practicing social distancing in the US or not. I think, all of this exists. The companies are willing to share it, but the government has to really step forward and assure these organizations and the corporation that, no action will be taken against them. Look, at the end of the day, since we are talking about a health pandemic, our health privacy system, right, was created at a time when, bioethicists, this is like 50 years old, they worked with the 1970s framework. Okay? If the government is interested in using this, they basically have to kind of explain to us how the anonymization and the processing of geolocation data can be done. And it can be done. And my co-authors and I, Bebe Lee and Meghnan Macha and Natasha, we've come up with new machine learning methods to anonymize data and also sort of use less data, location data, to get more action, more bang for the buck. Like if you think about the HIPAA Act, Health Insurance Portability Act, that requires 18 different identifiers to be removed from a piece of information that is not deemed personally identifiable, including names, social security numbers, IP addresses. Okay, so if that can be done, certainly this can be done as well. Okay? Of course, I have to preface in saying, look, caveats have to be added such that there's zero tolerance for the misuse of data. But I think if we wait too long let's not make the perfect the enemy of the good. This is, real-time crisis, time is of essence. And I definitely believe we can move forward in the right direction in enabling this coordination between public and private sector, and we really should. So with that, I'll stop my, webinar and looking forward to conversation with Professor Batia Wiesenfeld. And thank you, everybody, and stay safe.
Thank you so much, Anindya, for that really helpful survey of what's going on in technology and how it can be used to help address the crisis that we're in. I want to remind everyone that you are welcome to add your questions. After the first few questions from me, I will turn it to the broader set of questions and select them from the Q&A list. So feel free to go ahead and add your questions on the Q&A list. So Anindya, you are clearly an expert on mobile technology, and technology is becoming increasingly mobile. And in your book, you really, and in your research, you've kind of highlighted that the mobility is not just with phones, but with wearable devices. And I wonder whether you've done research on wearable devices in healthcare and whether any of those innovations could be useful in fighting a pandemic like this one.
Yes, so I can certainly, share with you some of the work that we've done. One of the projects is a joint work with Professor Batia Wiesenfeld, who I referred to earlier. She's at Carnegie Mellon, and with Professor Shitong Guo, who's at Harbin in China. This is a pretty fascinating idea. So, the big question with wearable technologies was all these years that is there any evidence that the adoption of these devices and technologies is actually making a change in people's lifestyle? Are people actually looking at changing their lifestyle after they've been tracking and recording all of their data, like how many hours are you sleeping and how many steps are you walking and how many miles are you running, that sort of thing. And different devices have different capabilities. Some these basic features are there in pretty much all devices, and some devices also give you more advanced features to input on your own, like what's your diet plan today, do you smoke, do you take alcohol, etc., etc. So what we did is we carried out one of the largest, randomized field experiments conducted in this space. I believe it's the largest, but I'm not 100% sure. Working with several hospitals and thousands of patients to look at the before and after. So we randomized the allocation of the devices to chronic disease patients like diabetes, blood sugar, and other kind of chronic diseases, and we looked at their healthcare outcome before and after. And we found that, yes, after about a 15-month period of adopting these wearable devices, people actively change their lifestyle, such as sleeping more and eating better and sort of exercising more. And not only that, we are also able to trace back their eventual healthcare outcomes, like did they have lower doctor visits, did they have lower symptoms of chronic diseases, did they take fewer medicines because they're already getting better, and that sort of thing. So there is that research that we were able to connect with wearable devices and chronic diseases. And to your other question about can this be used in some way for the COVID crisis? I think so. I think one of the studies I referred to earlier was Eric Topol's study, where they showed that if you look at the average heart rate of people over several
months, and then you see sudden elevation, right? That's often an early predictor that some acute respiratory syndrome is taking place. Okay, and what they ended up showing is that a pretty fascinating predictive model that shows that elevation of heart rate used by tracking the wearable device can be used to predict the likelihood of SARS-like diseases, severe acute respiratory syndromes. So I think there definitely is a lot of promise, and again, not just because of the location data from wearable devices, but also because of the other healthcare markers from that.
Yeah. So you were talking, in your presentation, you highlighted how this geolocation data can be harnessed to fight global pandemics. I wonder if you could tell us what directions you see as the most promising and what it's going to take for us to realize that promise.
Sure. So at the high level, I think we have seen so far that countries have essentially divided themselves into two buckets, right? So you've got one set of countries that is essentially using geolocation data for very aggregate level analysis, where they're looking at are people complying with social distancing and self-isolation and shelter in home. And we in the US, we are one of them. We've seen other examples like Italy and France and Germany, and mostly some of the countries in the West. Then you've got another set of countries, including Russia and Poland and Israel. And so not just the Asian Far East countries like South Korea, Taiwan, and Hong Kong, but even in the rest of the world, they've decided to do a far more deep dive into this granular atomic user level analysis of geolocation data, do contact tracing. Like, patient 31's story in South Korea is a classic case study of contact tracing, right? So I think the extent of potential of location data is a function of what you really want to harvest it for. If you are too concerned about, let's say issues about privacy, then, the trade-off is very simple, right? The trade-off is you can at best do very aggregate social distancing analysis.
But if you are saying, look, this is not the time to get bogged down by potential fears of surveillance, we're going to go all out, just like we did in Israel and Russia and South Korea and Singapore, then you take the other approach. So I think there's clearly two different directions, and time alone will tell the results, but the early indications, if you look at existing numbers in the US or Western Europe, compare that with the performance in the Far East or Israel or Russia or Poland, your inference is as good as mine, right? So,
yeah. I mean, this kind of raises the broader question of how, and I think it's something, I wonder if your research kind of addresses it, how we can balance the apparently conflicting goals of individual empowerment on one hand and public good on the other hand. How do we manage those trade-offs?
Yeah, so in my research, which was primarily focused at the intersection of technology and marketing, advertising, and the topic of my book, Tab, I essentially talked about a successful example of companies who've been able to take this very granular atomic data and then become your butler, become your concierge, not become a stalker, right? So there's a very thin line dividing, who's a cool butler versus a creepy stalker. And it turns out that the same data can be used or misused depending on what the institution is trying to do, okay? So those companies who've done this well, who've established this, long-term symbiotic relationship with consumers, are the ones who decided to become our butlers and concierges. And those who try to make the most of a myopic short-term, extraction of consumer surplus, they might have gotten away with a one-time extraction, but consumers are not going to go back to it, right? So what I'm trying to say is there's an element of trust and reciprocity that's very fundamental to a successful long-term relationship between consumers and institutions. So I think the same will go over here, right? So one of the things I'm advocating is, this very powerful private sector, public sector collaboration, right? And, there's going to be multiple entities involved in this. It's not just the government, you have public health officials, you have epidemiologists, you have medical healthcare scientists, others, academics, and so on, who will be involved. And so this will require, data sharing amongst various institutions. And I think this, can be done. We obviously have to make sure that there's zero tolerance. Appropriate caveats have to be built in the data sharing practices. So I'll give you an example. In Israel, they have said that after 60 days, all of the contact tracing data will be deleted, okay? So the government has come and assured its citizens that we're going to delete it after 60 days. Similar policies have been enacted in Singapore and Taiwan and so on. I think that's the kind of assurance that we need to hear from the public health authorities of the government, that if we are going to give you our access to our data, because these are challenging times, you need to give us assurance that this is not going to be misused or abused in any other way. And I think, the technology exists to make this relationship work. It exists. It's a question of mindset. It's a question of, both parties coming forward to shake hands and say, let's do this. Let's save lives.
Yeah. It seems like the value, though, of this mobile technology data and analytics depends on everyone having and using these devices. But the thing is that there is a digital divide. There's a digital divide in this country, but there's a huge digital divide in developing countries. And I wonder whether you think that COVID-19 is going to exacerbate that divide, and if so, what should be done?
Yeah, that's a really good question. So I think, there's a couple of different points that are worth bringing up. The first is that, location data is coming from smartphones, yes, but it can also come from a few other places, such as your ATM records, banking records, credit card transactions, CCTV surveillance, etc. So in countries where smartphone penetration is very high, this is probably less of an issue because you at least get substantial portions of people from whom you can get this. You're right that I think, there are parts of the world, include sub-Saharan Africa, where they have very high penetration of feature phones, but not yet high penetrations of smartphones, okay? Now, feature phones can still give you access to location data, so that problem gets solved. But there's another, sort of issue here that is worth mentioning, which is while the digital divide still exists because mobile phone penetration is not very high, can we think about other ways in which mobile can be used for the greater good? So one of our colleagues, Rob Siemens, wrote an article recently on Forbes about how mobile phones can be used for very quickly and effectively sharing the stimulus money, the $1,200 checks that we are supposed to get below a certain economic threshold, right? Right now, they're looking at, the IRS doesn't have everybody's banking records or phone numbers, so they're looking at 4 months of wait, which is an enormous delay, and almost borderline unacceptable delay in today's day and age. So I think this is an example where, smartphones, mobile phones can be used to quickly disseminate mobile payments. We've seen like the emergence of apps like Venmo and Cash App and PayPal, and some of the heaviest usage and adoption is not in the coastal cities, it's actually in the middle, it's in Midwest or Southwest or the North. So there is evidence that people across the country are amenable to adopting mobile payments as a mechanism to transact. We've done some research ourselves. One of my co-authors, Professor Yuki and Shu in University of Illinois, and she and I have just recently finished a paper on showing that how mobile payments adoption actually increases transaction frequency and amount as well. So I think there are ways in which smartphones can be used to bridge the digital divide. And so in addition to simply being an instrument for collecting location data, which is very useful on its own right, it can also serve another kind of public good, which is quickly disseminating the stimulus money into funds from the government back to the citizens who need it most.
Yeah, I'm gonna go to some of the questions from the audience and welcome more. But sort of the first of those is from our colleague Nick Economides, and Nick's asking: have companies asked for rescinding of privacy concerns, especially on location information?
Yeah, so in the US, Google and Facebook have been pioneering in this space. They have sort of released multiple data sets that I mentioned in the past, just before in the talk, including location mapping layer data, social networking data, and so on. It has come with sort of an implicit understanding that there would be no sort of lawsuits filed against them eventually. But the cost of that is they've only been able to release more aggregate, anonymized, de-identified, but fairly aggregate data. So it would be very difficult for, someone like me or Nick to take that data and say, oh, that belongs to Anindya, that belongs to Nick. Because the reason they had to mask this data at that level is because they haven't been given this formal assurance from the FTC or the DOJ that we're not going to come after you. And like I was saying, I think it's imperative that regulators see the big picture here, recognize that time is of essence, and then give this sort of empowerment to these companies to release and share more granular data. It's only like maybe 2 days back that we finally saw in New York City, zip code level data, okay? This was available to public health authorities for a while, but they didn't release it. I recognize the trade-off, right? Historically, health has, the stigma attached with it. So there's a trade-off there that you don't want to release which zip codes are suffering the most in case, people associate that with certain demographics. But again, it is a very clear trade-off, right? So do you care more about saving lives, or do you care about, like looking good, yes.
Yeah. So there are a number of questions that are clearly coming up, not surprisingly, wondering about whether the kind of data that you're talking about could tell us anything about when the peak will come in New York. And there are multiple people who have been, certainly our elected officials are predicting peaks at various different times. And I wonder if you're aware of any data that is kind of predicting what the curve looks like in New York, and whether there's any evidence of there being a discrepancy between what the experts think will be the peak and what the data is suggesting. Maybe if that question has been looked at in any of the places like in Spain or Italy or whatever, where we've kind of seen things play out, maybe in China as well.
Yeah, so I think, the answer to that is, I'll start off by maybe talking about, certain examples of countries that have done it well. So Singapore, in my mind, the two best examples of almost picture perfect prediction through very granular data collection are Singapore and Taiwan. Okay, they basically, we have this phrase saying nail it on a head, they nail it on a head. Okay, others have done well, but not nearly as well as Singapore and Taiwan. In the US, I have seen at least half a dozen different models and methods for this. This is the reason why, the range of mortality rates is anywhere from 100,000 to 240,000. Because one of the things that we obviously didn't do right away is contact tracing. Now, the good news is, while maybe the window for New York no longer exists for doing contact tracing, there's significant swaths of the US where things are in a very early stage, right? And so, if I were a decision maker, if I was one of the public health experts, I would seriously advocate for large scale, stratified random sampling in parts of the Midwest and the Southeast and the Northwest and so on, and contact tracing. I think the combination of this granular data collection along with stratified random sampling can go a long way. Okay, so I think there's still a lot we can do in the US to minimize and alleviate both the scale and the impact of this pandemic.
Yeah, so here's another very difficult to answer, I think, question. Whether you have any feelings about how the field of data science and analytics might be changed as a function of the COVID-19 pandemic. So do you foresee ways that COVID-19 is going to sort of change the future?
Yeah, I think, that's a great question. Some of us in the business school world, we've been talking and thinking about this as well, informally, of course, but it's early days. But personally for me, one of the things I'm really intrigued now, and I can see myself spending more time, is in trying to use this sort of, highly granular location or device level data for better understanding public health pandemics and emergencies. Okay. My focus of work so far has really been mostly sort of in the business commercial space, trying to, better target ads or better send better relevant offers and that sort of thing. But now that, we've realized this potential, truly massive potential of using similar data science methods and models, but in a very different world, one of the things I see is, more of a convergence between public health experts, epidemiologists, and business school or computer science academics, because business school and computer science academics, they can sort of bring in the heavy machinery with respect to causal modeling and predictive modeling, and public health experts and epidemiologists and medical experts, they can bring in much needed domain expertise, right? And if you think about this, Bill Gates, one of the biggest visionaries of our time, right? He had predicted 4 years back, that US is not ready for a pandemic. And yet we didn't do much, shockingly, we didn't do much. And I think, hopefully after this, if we all come out okay, one of the things that many of us, including myself, would like to do is sort of shift gears and, just jumping into better understanding, using those data science methods to understand, patient behavior or in pandemics and so on.
Yeah, I mean, one of the questions that kind of relates to this relates to how how feasible that will be, because there's certainly, you highlight not only using things like mobile phones, but also tracking credit card and ATM transactions. But in places like India that you know well, where people use cash and prefer things being in the tangible physical world, it does seem like it brings up that digital divide that we might not be able to make as good predictions. I wonder, you also kind of, and I guess one of the questions would be, could that mislead us? Could we then be, can you imagine ways that it could, the data that we have potentially leading to poor decision making? And is there anything that can be done sort of separately from that? Is there anything that can be done to address the cases that aren't yet detected, that are sort of in process in these countries where it's taking off? It's still early days.
Yeah, no, I think it's totally fair to say that there'll be differences in the level of analysis and predictions that I can do geographically, because if you think about China, they're ahead of the curve, right? They are years ahead of pretty much everybody else, certainly us here in the US when it comes to mobile payments, as an example, right? You mentioned India, yes. So, it's not a cashless society by any definition at all. In fact, compared to China, it's on the other side. However, India also has a very high penetration of feature phones and increasingly smartphones. So, while consumers are not fully adopting cash yet, the penetration of smartphones and feature phones being so high does give institutions access to a different set of data, like the location data. Okay. So I think, yes, there will be differences across countries in terms of the level of analysis you can do. But I think collectively, we are all creative enough to be able to figure out, what are alternative sources of data that can shed some light on the same problem. So I feel very optimistic that, going forward, we can do a significantly better job in sort of preparing ourselves from a modeling or prediction perspective. Now, obviously, it remains to be seen, what actions governments around the world take to minimize because this is not the last time this pandemic happens, right? There will be many more of these things at periodic intervals, and I think one of the biggest lessons for us in the data science field is that we now have access to a whole different set of machinery and toolkit because of the proliferation of devices and changing consumer behavior, and we just have to jump on that train, sooner than later.
And you see those models and predictions being what helps us to address the cases that are not yet detected, or do you see other technologies playing that role?
Yeah, so for example, for undetected cases, one of the things I talked about was doing large-scale randomized stratified sampling, giving higher weights to regions with higher population, like the 2 coastal regions of the US. That's certainly a very effective method. And then, the other example was using AI-based nanosensors to be able to predict. This was the article that you would email me, which was very helpful. So I think, there are mechanisms in play already. It's just that, like both hands have to talk to each other for somebody to be able to clap, right? So the machinery and the models and the intellect exist. Now it's time for administrators and regulators and the government to really take that and with a positive mindset make changes or proceed accordingly. We don't have the luxury of just sitting and thinking about this anymore.
Thank you so much for all of your insights. This is incredibly helpful. As we're coming up at the end of the hour, I just want to highlight for everyone in the audience that you can get some more of the specifics about what Anindya has written regarding what regulators should be doing to facilitate these solutions. That will be available on our website. We'll also make sure that the article that you highlighted that Rob Siemens had brought up about the $1,200 rebate that's coming from the government, that be, make sure that is also up there. So folks look out for that email soon with a link to our website. And also remember that the upcoming on Tuesday will be the session with Rob Engel that Viral Acharya is moderating. Thank you again so much, Anindya, for joining us. And thanks to everyone in the audience for your great questions.
Thanks, Batia. Thanks for having me. It was fun.
Thank you.